Medication checkoff, take 8. Let's hope this is the final one. Okay, I'm going to perform hand hygiene. And then I'm going to identify, gather, and prepare my supplies. So after washing my hands, I'm going to review the MAR and the allergies. I'm going to obtain supplies for administering oral meds, and I'm going to do that by use of a medicine cup and a cup of water. And the medicine cup will be used to put the medicine, the actual pills, in. Then I'm going to obtain my supplies for an SQ injection or an insulin injection. So I'd gather my syringe, my insulin, my alcohol pads, a Band-Aid, cotton swab, and of course the apple here will be my patient. Oh, and gloves. Next, let's see. I'm going to remove the medication from the drawer. I'm going to perform my first med check using the MAR. I'm going to select the proper medication. Then I'm going to perform my second med check and compare it to the label on the MAR. Or compare the label to the MAR, excuse me. Then I'm going to place the medicine in the medicine cup. Next, I'm going to draw up medication for my SQ injection, which means I need an alcohol wipe. And I'm going to wipe the top of my vial. I'm going to take my syringe and I'm going to do 20 units. So I need 20 units of air. Into my syringe, then I place the syringe into the vial. And I push the 20 units of air into the air that is in the top of the vial. Then I flip the vial upside down and I pull out 20 units of insulin. Then I replace the cap and set that off to the side. Those are probably my kids. Okay, next I take the medication to the patient's room and I would perform hand hygiene again. Now I'd provide privacy. I'd pull the curtain and perform aid it. Hello, my name is Joshua. I'll be your student nurse today. I'm here to give you your medication and your insulin shot. I'd make sure to thank them for allowing me to do it. I'd tell them how long. It'd take about 5 minutes of your time. I would access the EMAR, and then I would identify, or I would use 2 patient identifiers as I scan the patient's ID band. Then I would ask the patient if they have any allergies and perform my third med check by comparing the med labels to the EMAR, and I would scan each med. Then I would give the patient his oral medication. In this case, like I said, Jelly Bellies. My kids don't like these, but I do. And so I guess I'll be the patient because this here apple cannot enjoy Jelly Bellies. Can't even eat Jelly Bellies. But I can. So once I give the patient their medication and their water, I'll stay at their bedside until they swallow all of it to make sure. Next, I put on clean gloves. And I would locate the correct site for injection. And in this case, we're going to pretend that the apple here is the back of the arm, the tricep area. That's where I would prefer it. But instead, unfortunately, mine goes in my hip or my stomach area because I do it by myself. But if someone can do it for me, I would prefer it in the back of the arm. Then I'd get an alcohol pad and I'd cleanse the site. I'm going to use this here dimple as my injection site. And you wipe it in a circular motion. And then you let that dry. You don't need to blow on it. Next, I'll uncap my needle. I'll gently grasp the tissue to where I'm going to inject, and at a 45 to 90 degree angle, I'm going to inject the insulin. I'm going to inject this at a rate of 1 milliliter per 10 seconds, if I can get it to go without shooting it in rapidly. All right, pull the needle out, slide it back into the cap for safety. Then I would take this and I would dispose of it in the sharp spin. Then after the needle, I'd place a cotton swab or cotton ball on top of the injection site. And then I would place the Band-Aid on over top of the cotton ball. Okay, next I would remove my gloves and perform hand hygiene again. And right after doing this, I'd place the patient in a comfortable position. I'd put up his side rails. I would make sure his call light is in reach and that his bed is in the lowest and lock position. Then I would document what I just did with the date, the time, the site for the SQ, and a signature. And that concludes medication checkoff.